co-host of the radio program. He's the chairman of our advisory board and past partner at PricewaterhouseCoopers, Ron Bachman. Good morning, Ron.
Good morning. How you guys doing up there?
Good, my friend. Good to have you on today. How are you doing?
I'm doing terrific. Excited to be on the program and talk about the IHC University.
Yeah, did you have a chance to hear a little bit from John Young, what he was talking about?
I jumped on just at the very end. John's always thought-provoking, and I think he's right from the pieces that I've heard that the consolidation of the provider community maybe being bought by the insurers, but certainly a change in the delivery system. And there's a revolution going on, and we're going to see different approaches, and the winners will pop out at the end that are doing it efficiently and dealing with the consumer's needs and what they want. And the consumer is ultimately going to be the driving force in any of the changes that goes on.
Yeah, I think as we build the power of choice, that's where you're going to see the consumer influence really be driving this thing. But that kind of leads us nicely into the IHC University, because we want it to be a knowledge resource for our community to come to access some of these experts, to access some of this information. And Ron, you're kind of leading the charge here at the IHC on the development of the university. I mean, talk to us a little bit about what we're doing and why we're doing it.
And just a sidebar first, Doug, do we have to call him Professor Bachman now?
Oh, yeah, I think so. Dr. Bachman.
Dr. Bachman. That's my son, Dr. Bachman. The IHC University really is an exciting concept that Doug has put forward for the whole IHC experience. And he's asked me to take the lead in trying to develop some thoughts around it, some strategies, and then try to provide some structure around the development of the IHC University. So I think for our listeners out there, whether they're brokers, benefit consultants, solution providers, or caregivers, are going to find it very interesting as we build out the IHC University. The way I see it, the very first thing that an IHC university has to have is like most any other university. It has to have a library. And so we have been putting together surveys and HealthCare Consumerism reports and studies from various sources. The core strength of IHC in general, not just the university, is aggregating information and allowing people to navigate and find information that they want very easily. So we want to put together a library of resources that people can go to, information that they can find to support any kind of project that they're working on, any decisions that they're trying to make for their employees, putting together a plan design, or for helping their own customers, if you're a broker, as an example. We're trying to see where the market's going in general. If you're a solution provider, is what you're doing increasing in popularity, or is it decreasing in popularity? What new services do you want to put in? Well, see where the hot spots are by looking at the trends that are happening over time. It's a very interesting process to put together that kind of a library because the surveys that are out there from the different, whether it's consultants or industry surveys or brokerage surveys that are done, are different populations. And so as a result, you see different slices of the pie. It's kind of like putting together a big jigsaw puzzle to show a picture, but the jigsaw puzzle pieces don't necessarily match up with each other. So it's just sort of finding the right spots to draw the overall picture with recognizing that the surveys may be of different population sizes, of different geographies, of different industries. But when you put it all together, and nobody's done this before, nobody's really put together a profile of healthcare consumerism. You do see surveys out there that do a lot about account-based plans because they're so popular, whether it's HRAs or HSAs, because that's information that's sort of maintained at a broad level nationally, but also it has a little bit of a fuzziness around it because much of the data is held in proprietary databases by the insurance companies or by some industry groups that have insurance companies as members. So trying to find out how broad or how expensive even HSAs are is a little difficult to get a handle on, and different sources will come up with different answers. But when you put them all together, as we're trying to do by aggregating this information, you get a picture and a general range of results. And so you can get a good feel, and then if you have the archived information from past years, you can see how it's growing under any of the types of surveys, so you get a movement as well as a general conclusion as to what size of the population. So the first thing is IHC University is the library. The second thing we're going to try to do with IHC is develop classes. Just as with any university, we're going to have classes that we can put online. We'll have videos around various healthcare consumerism topics. The videos, many of which will come from the IHC conferences. We've got great speakers. We've got great topics. We have that over the last several years, and we'll continue to do that because IHC is always about what's new and what's on the leading edge. So we're going to have great videos for people to go and sit in classes, either to review stuff maybe that they saw at a conference, or if they weren't able to make a conference, they can be able to look at some of the leading edge topics and key national experts and speakers. We'll have videos from some of the pre-cons as well as the conference, webinars that have been put on and that we will put on in the future, and other IHC events. We'll also be able to add audios. If we don't have a video, we've got an awful lot of audios, especially from this IHC HealthCare Consumerism Radio program. We've got tremendous presentations that we can put together and classify and consolidate in ways that will make it easy for people to find the information that they're looking at. So it's the library and the classes will be some of the keys. Now, one of the other specific things that we're doing right now to sort of lay a foundation for the IHC University and where IHC is ultimately going is developing something that we're calling the IHC Market Insights. Nobody's put together all this information that will ultimately be in a library and be maintained and current. Nobody's put together that information in a report that sort of says what's happening with healthcare consumerism. What are the aspects of healthcare consumerism that IHC has put forth as identifying healthcare consumerism? How many people are doing what percentage of the population or what percentage of companies are offering up various wellness programs, health management programs, health literacy programs, disease management programs, what types of disease management programs? Are incentives being used, and how successful are they? Are incentives growing or decreasing? Are they for participating in programs, or are they for meeting biometrics? So there's a lot of information out there, again, that's never been put together in the sense of how rapidly are we moving towards what we would call the IHC healthcare consumerism dimensions of any plan, because it doesn't have to be just an account-based plan. Any plan design can put in these features of wellness or disease management or incentives. So that's sort of what we're putting together today. And the current development of the IHC Market Insights, which will create a core for this library that we've been talking about, we now have over 150 surveys that we've been able to find and access from over 30 different separate sources. So we're looking for as many sources as possible. We're trying to pull all this together, and we're trying, again, with the key aspects of IHC University, aggregate and consolidate and ultimately navigate this information easily for the users. Now, down the road,
Ron,
after we get this...
Hey,
yes.
hey, Ron, sorry to interrupt,
Yes.
but what are the types of surveys? I mean, if our audience goes in, what's the kind of information that those surveys encompass?
Well, the surveys are sort of split right now. We're trying to look at the various aspects of consumerism. So we start off looking at what percentage of the population, what percentage of companies are offering the account-based plans, and we move into what percentage of the companies and what percentage of the population are using various forms of wellness, and what types of wellness programs are they using. Same with condition or disease management programs. So we have surveys in all these different areas, but what we're finding very early on is that healthcare consumerism, if you look at it from a broad perspective, about 25% of companies are offering healthcare or offering account-based plans, as an example. Well, that sounds pretty low given it's been around the marketplace for a while, and I know John Young, who was previously on the program, has been sort of on the stump saying we're not advancing fast enough. We're not implementing healthcare consumerism with account-based plans rapidly enough, and they do have great benefits, as he was describing, from a cost standpoint. But what we're finding is that the vast majority of employees work for large companies. And the large companies have been very much more in the forefront of implementing healthcare consumerism. So the surveys show us, for example, give a few numbers from some surveys we have out there. Kaiser, for example, says that for employers that have 1,000 or more employees in 2014, 45% of those companies offered account-based plans. Well, when you do a little different slice from like PricewaterhouseCoopers, they have employees over 5,000 of their category split. 84% of employers are offering account-based plans. So you can see that the plans that are more self-insured, have more flexibility, are taking control of their own employee populations are rapidly implementing account-based plans. And then further, we see the other features of consumerism, wellness, disease management, incentives are also very heavily weighted towards the larger employers implementing it. Well, that's where the vast majority of employees and their family members are. So looking at that 25% of companies includes a lot of very small companies where actually there's more small companies than there are large companies by number. So when you do it by companies, it looks like we're not advancing rapidly enough or penetrating the market. But when you look at number of employees in the large companies, healthcare consumerism has got a very strong foothold and actually is a dominant force of those company plans. So those are the types of surveys we'll see where there are different numbers, and we'll try to ultimately draw some observations from those. We're not trying to draw conclusions or saying one study's right and one study's wrong. They're all right within their framework. But what we'll see is this painted picture of the movement towards healthcare consumerism in its various aspects. So surveys, reports, some reports show an annual study that gives us a clear history with the same question, same population basically answering the questions year after year, so we can see an easy trend there. Other companies do single surveys or single studies, so we'll see for one year, maybe 2010 or 2012, but there won't be a follow-up for the next year in exactly the same format. So again, you can see this puzzle has got different size shapes of each of the pieces, but when you put it all together and aggregate it like we're doing, nobody else has ever done that. I think it draws a pretty clear, distinct picture of where we are. Now, the next step and the final step in this is some of the new areas. What's really happening out there that's new and different? And there are some companies that have said and asked questions around their employers, what do you think will happen in 3 years? What do you think will happen in 5 years? So after we have that base of where we are today, we'll look at the future and say, okay, here's where things might be going, and then a couple of years from now, maybe we can check and see if that's actually occurred or not. So those are different types of studies.
And I think to Ron's point too, Andrew, is that what we want the university to represent and market insights, all of it, is that the scope of this marketplace. And, you know, some people just look at it as account-based plans, and then they might include health management, but it's everything in between, from engagement strategies, surveys around engagement, from the emergence of primary care contract, you know, what's happening there in the marketplace around innovation, what's happening with transparency, what's happening around telehealth. And we want to be that aggregator and that navigator and also the originator, because we're going to do gap surveys that will help fill in some of the gaps and inform. We're going to do webinars that will help develop some original content and some other things like that.
The other element of that, Doug, that I hear is the IHC serves the whole ecosystem of organizations interested in ensuring that employees are taking more control of their own health.
Right.
Brokers, solution providers, health plans, obviously employers.
TPAs, all of it.
And this university, and especially this marketing insight set of resources, provides something for each of those players to make better decisions in their businesses regarding healthcare consumerism.
And then we'll create, as Ron alluded to, at the end of this year, we'll launch to the marketplace the state of the healthcare consumerism, special report that we'll update every year, and it'll make it much easier for the market to read and understand and follow what some of the trends are, and then they can come back into the university and access market insights for some of the specific deeper dives that they need.
Great.
Right. And not to sound too much like a rapper, but I started off saying that this is about aggregate, consolidate, and navigate. But I think as we set that, we'll also move into another stage of collaborating with various vendors and surveyors out there to bring information and also originate. So we've got a whole bunch of ideas on how we'll put this together.
That's exciting stuff. Go ahead, Andrew.
The final areas I'd mentioned about IHC University is a little bit of a teaser to the audience out there, is that we also are getting a lot of the programs that we're doing in our pre-con, for example, and in these follow-up online classes that we'll have. We'll be getting continuing education credits. Don Cooper and I have been working together, and Don's been taking the lead on getting state approvals for CE credits. So, again, it gives another reason for people to come to the pre-con to get CEs and to come to these classes, and we'll work that out as we go in the future for many states. But I think we already are very close or have in hand CE credits for Georgia and Florida, Tennessee, South Carolina, Alabama, Texas, and California, working on many more. So that's an exciting new dimension and value that IHC University will bring to these educational classes.
And I think that not to tout our own horn too much, but the brokers and employers and consultants that have taken this certification so far like this program and feel that when they're done, they are better prepared, to either work within their organization on initiating, growing healthcare consumerism initiatives, or work with their clients around healthcare consumerism.
Right, and then the last area I'd mention here is we haven't got a final name on it yet, but I'll refer to it as the compliance corner. There's so many things around healthcare, whether it's healthcare consumerism or other things that are going on in the marketplace, that the benefit managers need to be sure that what they're doing is complying with all these new laws and regulations that are coming out, especially with the Affordable Care Act. So we're developing a legal library, if you will, of an archive of comments and executive summaries on all the regulations and legislations that come out. So we'll have an archive and develop at least one new piece, if not more, as we get more people engaged in writing articles about compliance. But we have a rather robust library already of about 25 to 26 that we're building in around all the different aspects of the Affordable Care Act and what it means to an employer and what kind of compliance is required with these regulations that come out almost weekly. We'll also ultimately want to build in what we might call Ask an Expert, so that we'll have some legal minds ready to answer some questions for people and give them some insights on some questions, so that you don't have to go out and spend $500 or $1,000 an hour for a lawyer just to get a very simple response back. I think we will let you tap into, as an employer or benefit manager or a broker, to ask a question. And if you want to go deeper, and if it really gets into a significant legal issue, you'll have a set of experts that you can go, and then you can either hire or pay a fee to answer your question, or know if you need some real legal advice on an ongoing basis, you'll have a set of lawyers that are well schooled and up to date on healthcare compliance. So I'm kind of excited about that, almost a law library that we'll be putting together.
Yeah, we're really excited about that, because you can't. Employers and brokers and alike are really challenged every day with trying to stay abreast of some of these compliance concerns and challenges and to stay up to date. So we want to help play a role and give them a place to kind of lean on and come to. So Ron, it's been fun. And to my audience out there and to our audience out there, Ron keeps trying to retire on us, but as you can see, the work he's doing, we're not going to let him do that.
I can't think of a better person.
There's so much we can do. It's fun. There's so much you can do if you think about IHC University and compare it to a bricks and mortar place. There's a lot we can do and build out and really make it valuable for the people who access IHC website and the people who come to the conferences. So it's a great adjunct to everything else that you're doing, Doug.
Good. Thanks, Ron, and I appreciate your time. Listen, enjoy your Memorial Day weekend with family and friends down there in Destin area, and to the rest of our audience, have a great start to your summer. Remember that our early bird deadline for IHC FORUM Expo is May 31st. In addition to not only getting a discount to attend, but you get your name in a drawing for a Withings watch, which is
Activité watch.
Activité watch. Again, have a safe, fun Memorial Day weekend, and we'll see you next week on HealthCare Consumerism Radio.